the right to do this thing. How?
Go back to your country.
No, this is my country. This is my Africa.
Your
Yes.
country.
Yes, it's Africa. This is my Africa.
You're the comedian. You're the
I'm
comedian.
telling you,
Tell
a
your
big
comedian.
one.
Tell
A
your
big
comedian.
one.
Say.
How? I'm an African. This is my Africa. I'm a Muslim. You can say whatever you want, but that is the truth.
Yes, my name is Christian Chizungu Kwigomba. I'm original from Congo, DRC. I've been living here in Durban for almost 19 years. I'm a father of 4 kids and 1 wife. Yeah, I have a newborn which was born in Addington Hospital on 28th of June. So which on 28th of July it was their appointment because one of my twins' daughter she was born with some of the problem, and the doctor writes a letter that we must come to see him on 28th of July. So we prepare ourselves, my wife, in the morning to go to the hospital so that we can see a doctor, where we meet people who are on the gate. They never allow access to go inside the hospital. We try to explain to them, but they deny until I was pushed and fall down with my baby. That is where I was stand up and tell them, why are you doing this to us? So I faced a very bad experience, which a human beings cannot supposed to do to another human beings, and especially Africans people doing that things to another African people is really wrong. Is very bad, because there what is happening there is the matter of living and life. Because some people after leaving the hospital they die because they never get a medication, they never get treatment, they die. Some pregnant mothers, they can't have a place to deliver their babies. So we experienced a very bad experience of March. So I please with the authority of the government, with the UNCR and everyone who can come for help to act fast before these things is getting worse, because people are losing life. Is a life of people involving in what is happening there. Like I myself right now, my daughter, she's in the house, she's sick. She's only 3 weeks. She's an innocent baby. She's very sick. I can't afford the private hospital. And not that I'm illegal. I'm legal. I'm legal, I'm a refugee, I'm legal with all my documents. My kids also are legal, they have a birth certificate. So they were born there at Addington Hospital. So now we are there in the house, my kids, they are sick. I myself also, I supposed to go to the Addington yesterday to collect medication, because I usually used to take the medication from sugar. But I can't go because they're not gonna allow me to go inside. So like we're standing here, our life is in danger. We're only waiting for die, because there's no way we're gonna get help if the government they remain quiet like this. If the UNCR, Nation United, you are OEM, and all those supposed to come on our help, they remain quiet, meaning we are waiting for dying, because we are human beings. We got sicknesses in our body, and there's no way we can go to treat our sickness, meaning that we need to wait only for dying. Yeah, so I will please with the people of authority to helping us, and also I will send this message to March. They must always remember that we are African, we are brothers. There's no supposed to do like this to us, because this is what they're doing it to their own brothers. They are calling themselves they are Bantus. They forgot that also we are Bantus. They should also know the meaning of Bantu, and the spirit of Buntu should come in them, because whatever they're doing, treating Bantu, which their brothers, is not right. It's not right. It's not really right. And Yeah, that is all I think I have in
I'm Teresa Nortia, and I'm here to represent the March and March movement. I understand where they're coming from, but as we all know, this movement has started like a month and 2 weeks ago, where we are asking the South African citizens to please produce their identification here at the hospital, due to the fact that we had an influx of undocumented foreign nationals, where we also have the proof thereof, where they submit falsified documentation, whereas they put pictures of themselves on top of another picture. Also, the identification cards that is being submitted here, where the guy says that he's 60 years old, but when we look at the identification card, he's only 45 years old.
Sorry, Mama, why you speak?
The department has noted protests by individuals and organized groups around health facilities in some provinces, in which healthcare users are requested to produce forms of identity documents before access facilities. We condemn these actions because they go against the laws of the country, especially Section 27 of the Constitution and National Health Act. While we understand the concerns raised by these individuals and groups, we urge them to raise them within the confines of the law, because the issue of undocumented migrants is a societal issue, affecting all sectors of society. We call upon law enforcement agencies to enforce the laws without fear or favor. We call aggrieved parties to raise concerns while suggesting long-term solution to these challenges caused by undocumented migrants. Lastly, we condemn anyone entering the country illegally with the sole objective to access healthcare in South Africa.
The South Africa Police Service, along with other law enforcement agencies, are implementing an operational plan to address protests by groups blocking foreign nationals' access to healthcare facilities. The SAPS, in collaboration with the Department of Health, is deploying public order police to maintain law and order during the protests at the affected health facilities. Law enforcement will continue to apply the zero-tolerance approach for lawlessness, with decisive action taken against individuals taking the law into their own hands and intimidating patients at health facilities. Law enforcement officers working together with the Department of Home Affairs will continue to arrest and prosecute foreigners who violate the Immigration Act. Government calls on all communities to uphold the rule of law, respect human dignity, and continue to work together to build a united and inclusive South Africa.
In the meantime, refugees like Christian, who are in the country as refugees due to the never-ending war in the East African country, are branded illegal and denied access to medical care by an unelected group acting without a mandate.
And also, I've been receiving calls for the people, stranger calls, which people they're treating me that they tell me, Kwere, who do you think you are? You can never stop us. This is not your country. And if you continue try to stopping us, we will kill you. We're gonna definitely kill you. We're gonna definitely kill you. And I don't know where they get my number, how those people they got my number, but I try to speak to my leaders, because as a Congolese community, we got a leader who's Mrs. Solange. I tried to speak to her, by surprising, when I sent her those numbers that were calling me, they also, the same numbers, they also calling our leaders. And they also treat her that, who do you think you are by helping foreigners? So, my life is in danger. As I'm talking right now, my life is in danger. I'm living in fear. I don't know who can kill me at any time, because this is different number that are phoning me. I'm already sent to my leaders. My leadership already sent it to the, I don't know, to the crime, what, I don't know, the police to open the case over it, because also the same number I've been phoning her, they're also threatening her. So as I'm talking right now, I don't know who's gonna kill me, and I don't know why they're gonna kill me, but that is the story. The numbers were phoning me that they're gonna make sure that I disappear.